to loop back, this is what you're gonna see. This is your suction. If you have wall suction, you have your canister. This actually goes to here. This goes to the NG. You have full suction or regular. All right, this is where you set the negative 120. Oxygen-wise, this is your oxygen. It goes to 15. The full, we would stop. What you do, I don't have the oxygen. You can't have this. Isn't like real. It's just set up. The top of the ball and the oxygen tells you how many liters they're on. Okay. This is called a Christmas tree because it looks like a Christmas tree. This is what your tubing attaches to. These are supposed to be changed for every patient because this line goes from their nose back to this. So any type of infection could eventually move all the way from the line clear back to here. Medical air is going to be used for respiratory therapy. All right. So we have that suction, canister, oxygen. All right. I'll try my best. It's been a while since we've done this, so we'll see what happens. This is going to be your layout. I'll be sitting over here at the table. You'll come in. You'll do your head to toe. Your 2 assessment questions will follow, and then that will be it. All right? And I'll say, are you ready? And you'll say, yep. And I'll give you 10 minutes. All right? You get 10 minutes, because if not, some people can drag this out for days. It should be 10 minutes. I'll probably give you an index card too that you can fill out on one side. Anything you want to write down. If it helps you, you'll come in and I'll say it's time for your head to toe. You can look at your index card, then you give your index card to me and I don't give it back. All right. And then you go. All right, so here's, we're going to call him Frank. Frank will have a wristband next week, or when we do this in a couple weeks, with date and birth and all that stuff on there. All right, ready? Okay. All right, hello, is this Frank? Okay, it's Frank. Hi, Frank, my name's Lucas. I'm going to be your nurse today. We're going to do some stuff. We're going to do it head to toe. We're going to take a look at everything, and we're going to listen to you and then fill around a little bit if we need to. You've been having a good night. All right, you had a good night. You got some sleep. You don't like that thing in your nose? Yeah, I wouldn't either. Can you give me your name and date of birth? I'm going to go ahead and check your band here. Oh, yeah, it's the one behind your head. You look relaxed. All right, Frank, yes. All right, the birthday's good. Frank, can you tell me where you're at? Yeah, you're at Henderson. Good. And you got some good sleep last night? Great. You having any pain, Frank, anywhere? Any chest pain? No? Okay. I noticed you have an NG to wall suction. Are you having any upset stomach, any nausea, vomiting? No? Have you been using the restroom, like making urine? Okay, that's good. I noticed that you have a Foley bag over here on this side, and it's got some urine in it. Does that Foley feel okay? Are you having any discomfort down there? No? Okay, we'll look into that a little more, but it looks like you're making good urine. Any stools, since you have the NG? I know we're sucking all that gunk out of your stomach. You haven't felt like it? Okay, well, we'll listen to your stomach in a little bit and make sure you're doing all right. Frank's been in, answering all my questions appropriately. He's responsive to me coming in. He said hello. He knows where he's at. I like that. I can kind of tell, though, Frank's pupils are way off. He must have an old traumatic brain injury that he's suffering, so we'll keep an eye on that one. How's your vision, Frank? Is it okay? This looks pretty good. All right. So no pain going on, no shortness of breath, no chest pain. I always like to get those out of the way. We're just going to fill around a little bit. I'm going to check your radial pulses. Any skin issues been going on? Let's check those brachials. Pretty good. I know you've been in bed a lot. Is the backside feeling okay? Or do we need to take a peek at that one? Yeah, we'll look at it. We have some creams that we can put on there too to help your backside. I'm going to have you step forward if you could there for me, Frank. Great. What I'm going to do now is I'm going to listen to your heart, your stomach, and your lungs, and I wanted you to hold your questions until we're done. And we're going to go ahead and listen to those for anything abnormal. We'll get them all out of the way while we do them all at once, and then we'll have you come back and answer any questions. So we're going to start up here, the aortic, pulmonic, tricuspid, Listen to the mitral valve. Oh, Frank's got boobs. The mitral valve, mid-clavicular, fifth intercostal for a full minute. That sounds good, Frank. All right, I'm going to go back and we're going to listen with the bell to check for any murmurs. All right, good. Well, I got you sitting here. I'm going to listen to your anterior lung sounds. Let me start up here at the apex. Now, while we're doing this, I'll let you go ahead and take your deep breath in and out, and I'll move on your pace. But as we know, Frank's doing this, I'm working in a lateral motion, bilaterally, as I hear. And I know when I do the back, I got to listen to the right side a little better because that's where his middle lobe's going to be, since he has 3 lobes on the right, 2 on the left. So I do that ladder all the way down to the bottom of the rib cage where the diaphragm separates. I got a chance. Looks good. His skin looks good. I'll have to note though, Frank, you do have a reddened area on your coccyx. He does, if you look, it's already built in, a nice reddened area. It's not nice, Frank, but we'll take care of it. All right, listen, I'm gonna have you just lean back. Okay, go ahead and relax. I'm gonna listen to your stomach. How's the stomach? Okay, soft? Okay, start down here. Your stomach doesn't sound real active. I can hear that wall suction happening. That can make listening to the heart difficult sometimes in the lungs. All right, Frank, your stomach seems soft. Any pain there? All right, no pain, that's good. All right, since we have you here, Frank, we're just gonna check your skin. Arms look good. The back was fine, but the coccyx was reddened. Frank has a little reddened skin underneath his right breast. All right. Oh, Frank, you didn't tell me you had an ostomy. And it's got Smarties in it. You're supposed to take them out of the wrapper, Frank. All right, so we have an ostomy. Your ostomy, oh, it's beefy, pink and red. Looks good. No problems there. It's making good stool. All right, let's cover you back up appropriately. I saw we have this catheter line. No problems with that. I don't see any discharge. Seems to be making clear urine, no sediment. All right, let's check out your leg, buddy. It's looking good. Can you pick your leg up for me? Great. All right, we're gonna feel your tibial pulse, psoas pedis. Check your cap refill. Can you move your foot? Yeah, good. Push against it. Pull back. All right, great. Nice, Frank. Any tenderness back here in the calf? No. Let's check out your other side. There's that too. Make sure it's not breaking the skin down. Hip feels okay. How's that calf? You lift that leg. Great. Flex. All right, push against it. Oh, Frank, you are tough. Strong. Good muscle. Pulses are good. Cap refill looks good. All right, just relax, Frank. Good. You've been getting up out of bed? Yeah. We checked your pulses up here, but I didn't check your cap refill. We skipped past that. Those look good. Give me a squeeze. Push. Pull. All right. Skin looks all good. Now, I didn't quite see your whole backside. Can you reach over here for me without falling out of bed and roll? Just some reddened area at the top of the gluteal fold. Looks blanchable, maybe stage 1. not full skin or partial. All right, great. Good job. Looks good. We listen to the bowels. Bowel sounds are hypoactive. He has this NGN. We're giving his stomach a rest. Can you open your mouth up? Just want to make sure, since we're suction, you're not getting dehydrated. Pink, looks good. Secretions are in there. He's not drinking though. His stomach's actually on bowel rest. Eyes look good. Hair's nice and gray. Oh, he's got a little alopecia up here on the top. It's got a nice little circle, which you've been looking at mine the whole time. All right. Ears are aligned with the eyes. Trachea's midline. He's on room air. Okay, I don't know what I missed. I'll probably missed something. So we'll go back and look at her head to toe. Questions?
Do we go to evaluate the radial nerves?
No, because unless, all right, this is a situation. What you see here is what you have. We're not going to lead into, well, this is a traumatic CVA or he has neuro issues. That's when you, if you have, good question, if you have somebody who had a stroke and you come in and you do assessment, you do what I just did, but then you come back with your stroke assessment. That's the focused assessment part. Then you would say, can you smile? Can you puff out your cheeks? Can a rock float on water? Logical stuff. All those different pieces and parts is what you focus. But you need the head to toe to see where the focus needs to go. All right? He could have an incision. He could have an ostomy. He has a nice red spot on his butt. All things that you find out as you go through. Yes?
Do you want us to pretend to do hand hygiene, even though there's no sink?
Knock, knock. Hey, I'm going to wash my hands real quick. I'm Tatum. I'm going to be your nurse today. My hands are clean. All right, good. Yeah, it's fine. I mean, it's on the head to toe, whatever. I don't get too caught up on that right now. I just want to make sure you can do a head to toe. There's a body in there, and it's warm. Can you tell me what's wrong? All right. And if you find an abdominal wound on your patient, either there'll be a big dressing on it, where you can say, well, I don't see any drainage right now, so we're just going to leave that be. It looks clean. Or it could be an abdominal, remember those stomachs we had laying out? I could put one of those on here, and you could be like, oh, I see you have staples. It's kind of reddened around those staples. That's concerning to me for possible infection. Or if it's dehisced, you're like, ooh, your stomach's dehisced. We need to get you to OR. I would put some wet, normal saline gauze on there. All right? I want it to be very straightforward, though, for you. Like, just so you see something is wrong, you're identifying it. Foley's not normal. Any other questions? Does this make you feel better? Or like you gotta study more? But see how we're taking all those people